Hello, welcome everybody. Thank you for joining us today, and I apologize for any inconvenience if anyone was waiting. Just slight technical issues. So, moving on, today we will be covering a topic. It's actually a common occurrence with children. It is constipation. So, introducing our speaker for today, it will be Dr. Ong Sik Yong. He's a pediatric gastroenterologist at Glen Eagles Hospital, Kuala Lumpur. And without further ado, we will pass the webinar on to Dr. Thank you, Doctor.
Oh, hi. Very good afternoon to everyone. Thank you for spending your afternoon and sorry for the technical glitch. Today, we're going to actually discuss a common problem among children, which is constipation. So can you move the slide to the next one, please? Thank you. So in the next 20 minutes or so, I think we are running out of time. So we're going to actually cover these few common questions that I come across when parents bring their child with any complaint around constipation. So in order to understand all this, all the problem better, so I actually try to make it in the Q&A format. So can you move the slide next, please? So people actually always wonder whether constipation among children is actually that common. To answer that question, actually indeed, in a survey and multiple survey that actually has been done, at any one time, if you actually do a survey on any age group, there is as high as 3 in 10 children actually suffers from constipation. And not only that, actually this is common, a good proportion of them actually continues to have this constipation towards their adulthood, meaning they grow up to be a constipated adult. And they are troubled frequently by painful defecation. They also will be presenting with abdominal pain that disrupt their activities or even their sleep or their performance in school. They are being called back from school. And if the problem is actually not dealt with time, actually they will be complicated with what we call fecal incontinence, where they have accident bowel motion into their pants with the fecal smear or poo smear on their pants, and pity all these children to be labeled as smelly kids in the school. So constipation in children actually always starts with a seemingly invisible illness, because a lot of time children don't really talk about their bowel motion to their parents. And you can see among our children, when they do bowel movement, they try to hide themselves. Only until they encounter pain or discomfort, then only this will be revealed. Next. So parents actually, when they come with whatever complaint around the tummy area, so when I tell them actually, oh, the child is indeed constipated, then the common comment that I get from parents were, but my child actually goes to toilet every day, can't they? They can't be constipated. But I think constipation, sometimes we only actually equate it with how regular you go to toilet, but actually it's more than that. When a child has either one of the 1, 2, 3, meaning whether they pass a hard poo, or they have actually difficulty passing their poo, or their toilet visits are actually not regular, that actually can already call a constipation. Next. To give it more objectively, so there's this Bristol stool chart that actually you can type and search in the internet, that actually show different texture of stool from type 1 to type 7. So what it actually basically show is the texture of the stool from the type 1, which is very hard, until those very watery type. The ideal stool that we should aim for is actually type 4, where sometimes we describe it as like a banana or sausage type, and which is soft and smooth to be passed. But when actually a child actually passes anything from 1 to 3, or sometimes people call it, type kambing, type rabbit, the kind of stool, then actually they are constipated. Next. So, and some actually also ask, actually, how frequent should a child pass motion? So this is actually a very good survey among children from the age of they are born until they are more than 3 years old. On the right hand column, you can see bowel movements per day. So averagely, say for example, a 3 months old baby would actually pass motion about 3 times a day. This is in average. And when they grow older, the malmotion actually reduce in their frequency to only once when they are more than 3 years old. But there's always a range, meaning actually not every child would need to pass motion every day. Some actually would only pass motion 2 to 3 days once, meaning once in only 2 to 3 days. But as long as their poo is actually soft, they are not constipated. So I give you another example would be children, I mean babies who are breastfed. Some baby actually they poo every feed or after feed they only poo like every week. So these actually are still normal for breastfed babies as long as their texture is still normal. Same goes with formula fed babies. We notice actually formula fed babies actually they tends to pass motion less, and when they poo actually sometimes can be every 1 to 3 days. But again, texture is actually the deciding factor. Next. So another question that I frequently encounter is actually when a baby of 6 months and below, meaning from they are born until 6 months, parents actually brought the child and say, "Oh, is my baby constipated?" When they actually see their baby actually struggle to poo. But often actually, I told them that actually they are not constipated because children less than 6 months or babies less than 6 months, they have the condition called infantile dyschezia. It's actually a period where these babies are learning how to pass motion. So they are trying to coordinate their bowel opening, and at the same time they are straining. So often actually they actually close their bowel opening when they try to strain. So that's why actually they struggle. But with time, actually, as they learn, actually then they will actually pass motion easily. But as long as the texture is actually soft, then they are not constipated. Next. So, what are the problems if actually one not, I mean your child actually has constipation? They come sometimes can come with stomach cramps or pain, and you will see actually children who are constipated actually eat less than their peers, and some actually because of the pain they become a bit irritable and they feel uneasy. And when the hard pull actually causes tear at the anal or the pull opening, so actually they feel pain when they want to pass motion, and actually that leads to a holding on behavior. I mean, actually when they feel the urge to poo, but they try to avoid to poo because of the painful experience. Next. And if this constipation actually is not dealt with, as I mentioned, in the long run, what will happen is actually the poo will accumulate in the rectum. Rectum is actually the part where the end of our large intestine or our colon. So if you look at the picture in the middle, so what happens actually, the poo get accumulated because the child refused to poo because of the painful experience. And when this poo actually stay longer in the rectum, the water get absorbed more. So then the end result is actually the poo is going to get harder and harder. And with time, what happens actually, this big hard poo is not going to come out. And what actually goes through is actually the liquid stool that flows at the side between the poo and the bowel wall, and actually just come out from the anus or the bowel opening without even the child realizing it, to cause what we call the fecal incontinence when they saw it in their pants. Next. So what causes constipation? Well, I think a lot of us actually know what is the culprit. Among it is actually bowel habits, because children actually, most of the children actually, they don't actually goes to toilet often, and they would only wait until the urge to poo, then only they go to toilet. So that actually causes the irregular bowel habit. And when the irregular bowel habit leads to hard poo, then actually that leads to a holding on behavior where they actually refuse to go to poo because worried of the painful experience. And this actually happens when there is a change in the toilet environment or the change in routine. Say, for example, a child is being brought to vacation and they are not used to it, or even forget the urge about to poo. So sometimes they keep the poo for a few days and causes constipation at the end of the day. And of course, diet, as many of us would realize, actually diet actually play an important role in contributing to soft stool. Next. So, if a child actually being constipated, a lot of people actually are worried. Are they going to develop cancer because the poo gets stuck too long in the intestine, or will they develop any problem because they are not pooing for long? Do we need any investigation? The answer is actually no. Most of the time, because constipation will be able to be diagnosed clinically, meaning by asking questions, by doing simple physical examination. In rare circumstances, only a person would need investigation if a person has constipation. If we suspected that actually there is other organic disease, which we will tell from our physical examination. Next. So to begin with, actually, if you want to help your child, sometimes your child might be constipated, but you are not sure. So it's actually to first look at the poo. So if you can actually inspect or even let the child report themselves, actually, what are their poo like by showing them the Bristol stool chart, remember? So they would be able to tell whether the child is actually constipated. So if they are indeed constipated, a lot of time, actually, you can do some self-remedy at home by actually encouraging them to actually maintain a healthy bowel habit, which I'll explain a bit more, and also healthy diet. Next. So how to maintain a healthy bowel habit, especially for those less than 5 years old, when they don't have a regular bowel habit, is actually to encourage them to develop the habit of sitting on the toilet regularly. And when is the best time to do that? We will actually encourage to do it after their meal. So what happens actually when once eat a meal, when the food actually went into our stomach, there will be a reflex neurologically to open our bowel. So we should actually take advantage of that reflex to actually encourage child to poo. So which will be the best time for them to open their bowel. Of course, when you ask the child to go to toilet regularly, um, you probably need to reward them and reinforce them that actually this is a good behavior. Some actually do star chart, or sometimes just with simple good remarks on whatever they do when they actually sit the toilet for a good 5 minutes to encourage that bowel movement. And of course, keep telling the child that actually if they ever feel the urge to poo, they wouldn't need to wait for that time, the particular time that schedule them to go to toilet. They can go to toilet anytime. And of course, toilet equipment is actually very important because a lot of time we will actually think a child is actually a small adult, but they are not. So next. So what is actually a good toilet equipment would be? So for a child big enough that you think can sit on a adult toilet bowl. So what actually we encourage actually to see if they need a toilet inset. Inset means actually there is a toilet seat specifically designed to cater for the size of a child. So then the child wouldn't be struggling or worried that actually they will fall into the toilet instead of focusing on their business. And the other thing is actually to make them feel stable. Putting their leg dangling and not touching the floor actually would be making them feeling insecure again, or feeling that actually they're going to fall down. So actually to encourage a comfortable bowel motion or business experience actually was to actually ask them to sit on the toilet seat comfortably with their foot rested on the stool. And this is also an angle. If you can see the child sitting on the left side of the cartoon, when they sit actually at that right angle, that actually will also create a physiological, anatomical position for the poo to come out as well. Next. So this is my books for my boys. So actually, this is the books that I use to tell them what are the things that people do when they do business and why is it important. So these are the storybooks that actually you probably can also tell to those young infants or toddlers to encourage them to sit on the potty for a good 5 minutes. And of course, once they get into it, to keep them on the potty every day for 5 minutes, actually you probably need some other things to occupy them. Screen time for 5 minutes is okay, is allowed, or even actually storybooks for them to play around is actually also encouraged. Next. So, of course, healthy diet is important. We know actually both fluid and fiber contribute to soft stool. So, for us, people always ask how much fiber is actually enough. So, a simple answer to that is actually at least 2 servings of fruits. So, I always tell my parents, I mean the patients' parents, is actually just use the size of the child's feast to see if actually they can eat 2 servings of the fruits each day, and also together along with the vegetables. That actually is good enough. And anything more than that, of course, is encouraged, but actually not necessary. So people always ask if I eat more fibers, then actually, of course, the bowel habit actually will be better. The stool will be softer. But sometimes when you do much more than what is needed, sometimes it can actually cause a counter effect to the stool volume actually. And sometimes people actually also didn't realize actually when we eat fruits, we always encourage to leave the skin. I mean, to eat with the skin, not peel. Of course, you have to wash it to wash away the wax. Next. So to give you an idea, sometimes people or some parents actually they are very particular of how much exactly. So this is a formula that actually we calculate, but I think sometimes not very practical because there are not many things with food labels. So this is a formula that we use. But what more practical will be the next slide. Will be actually to see what are the food sources that contain a lot of fibers. And surprisingly, actually, a lot of people don't know actually beans on the left table actually listed a lot of different beans that actually we can find in our daily diet. And so as the other different table on the left, on the right is actually those from vegetables and fruits. Yeah. Next. So fiber, as I mentioned, actually, if someone's were to eat apples, try to leave the skin on, so then actually they actually provide more fiber in their fiber intake. And of course, for a child who actually seldom eat fruits or vegetables, sometimes you might need to do this gradually because sometimes in a sudden change of the diet, you might actually causes a counter effect. Not only the child will refuses to follow what you actually want them to do, but sometimes a sudden increase in fiber intake, say for example in a day or two, might actually causes a heart pull and causes a lot of problem. Example is gas cramping or bloating. Next. So water intake, of course, we can see children nowadays actually bring along a big bottle of water to the school or to their play school. But how much water intake is actually adequate or how much is actually too much? So to us, actually, there's a formula to calculate, but simple rules is actually for a 10-kilo child, they probably need 1 liter. For anyone who actually is 20 kilo, they probably need 1.5, and anything above that would be nearing to 2 liters. So that's actually a simple guide. Next. So when to see a doctor? If your child is actually under 12 and they have constipation, like the symptoms or the sign to suggest constipation, I would advise them, I mean, to bring to see us or any doctors to clarify whether indeed they are having constipation, which might again bring along many other problems. And if they have constipation, then you actually can try your home remedy. But if they already started to develop significant pain or discomfort and it is causing other warning signs, say for example you see blood in their poo, of course you need to bring them to see a doctor. And children who actually has constipation with symptoms, when they see a doctor, often actually they'll be given laxatives. But the pitfall in treating children with constipation is often laxatives or this medicine or stool softener is only given for a good 2 to 3 days, which is not going to solve the problem a lot of time. Next. So again, as I mentioned, stool softener need to be given for a good period while someone actually try to adjust a child's toileting habits or the dietary habits. I don't think habits can be changed within a matter of few days. Perhaps it might need a bit longer. So during that the period where ones have to change their diet or the toileting habits, stool softener is actually essential to be given. So then they have always soft stool and not to fall into the vicious cycle, remember, of the hard stool and the stool beholding behavior until a child would be able to go for a regular toilet or bowel opening, and at the same time would be able to tolerate certain amount of fiber and water intake. Perhaps then it's time to actually taken them off from the stool softener. And of course, a stool softener comes in various forms, including common one would be lactulose and any other many other examples that perhaps the doctors would actually recommend. Next. So in summary, actually, I hope I convince you that actually constipation is actually a very common among children and indeed actually causes problems and symptoms that disturb children's daily activities. So if knowing the child having constipation and the usual measures that you do at home is actually not helping the child, I think the child need to see a doctor to help them out. And good news is actually children with constipation, given the right healthy bowel habits and also the medicines, they are usually easy to control. Yeah, with that, actually, I end my talk, and I'm happy to take any question if there's any. Oh, so yeah, I forgot. Actually, this is something that I would like to share with the audience. Is actually useful links that you actually can go on. You can click on it, and actually there are a lot of resources, things including a cartoon that you can show to your toddlers or even a child. What actually happens when one's constipation, one person is actually constipated, and also resources to help people to overcome children who actually has fecal incontinence, how to encourage healthy eating habit, and so on and so forth. It's actually a very useful link. Yeah, I think that's all. Yeah, thank you. Yeah, that the link was actually the last slide. We can't hear you, Kelly.
Okay, thank you,
Yeah,
Doctor. Thank you
yeah.
so much. And again, thank you so much for joining us today, Doctor. It looks like we've covered all the information that we require. So we will go ahead and take time for some questions. And just a reminder, please be sure to type your questions in the chat and we will answer them. So, Doctor, I believe we have a few questions. Right now, we will open the floor for questions. Um, I will put it up. Miss SK Wong has a question. Does probiotics help with kids' constipation?
Oh, I this is actually a very common prescription given to children. Um, in in our practice as a gastroenterologist, probiotics actually not proven to help children with constipation. Even though I think a lot of practitioners actually give probiotics to children with constipation, but a lot of time this is actually only given a child a short-term effect, and we are not discouraging giving probiotics, but giving probiotics actually deviating the treatment from the real core issues, because what happens actually the things that going to help a child with constipation is rather the medication such as lactulose, which is a very safe medication. We have put patient on very long-term lactulose without much problem, and in a way, lactulose, for your information, is actually a form of prebiotics. Prebiotics is actually what we call food for the good bacteria. So what happens actually, these lactulose, because they are not digested, so when they are consumed, actually they will be passed to our large colon or large intestine, and the good bacteria in our gut actually will consume this lactulose or these prebiotics, and that actually will make the good bacteria happy to work for us. Yeah, instead of getting a probiotics. Yeah.
Okay, thank you, Doctor. Actually, I have an issue with my niece. My niece does get constipation. She's about 2 years old. So I actually have a question of my own, if you don't mind, Doctor.
Yeah. Okay.
Baby, sure. Babies, toddlers, and infants all have different issues, right? But how do I identify if it's dietary or internal issues?
I guess when you say internal issues means actually whether they have any anatomical or any
Yes,
structural issues.
yes,
Yeah,
that's right,
I
Doctor.
think, yeah. So structural issues actually can be easily identified if a child who is actually not passing regular motion or constipated. Along with that, actually they have a very bloated tummy, meaning the tummy is actually very bloated, and sometimes they do have vomiting,
Mm-hmm.
and if the if the bloatedness actually also causes pain, so actually this actually warrant visit to a doctor to make sure this is not something structural. Being structural means actually perhaps the bowel is actually narrowed at certain point to cause the constipation, or the bowel innervation, the nerve to the bowel is actually very weak to cause the bowel obstruction. But as I mentioned, bowel obstruction, you can tell if one actually has bloated bowel, meaning the tummy is actually very big, or sometimes actually they vomited, and sometimes if the bowel motion is actually so irregular that sometimes they only pass motion like once in 2 weeks or even longer. So sometimes this actually causes a lot of concern, and definitely actually need to be brought to doctors to have a look. Yeah, but from our experience, 95 or even higher than that percentage of the time, most of the constipation in children are related to their bowel habits and their dietary habits rather than the structural or the anatomical problems. Yeah.
Oh, okay. Okay. Thank you, doctor. Hold on. We have one more question. Actually, we have two more questions. Well, does breast milk versus any other milk play a part in children's diet? Sorry, and which would be better to ease or avoid constipation in babies or toddlers?
Yeah, I think breastfeeding mom would agree with me that actually breastfed child or children who babies who actually consume breast milk, their bowel motion is definitely much better compared to children on formula milk. This is across the board. And for children on formula milk, actually also depends on what formula they are on. So of course, there are certain formula that actually promote bowel motion, that actually will ease the child's or soften the child's stool. So of course, if you ask the question of whether certain milk actually promote or avoid constipation, indeed there is. Yeah, but of course we are not going to talk about brand or any products here
Yes.
in our talk today. Yeah,
Yes. Okay, thank you so much, doctor. We have one more
yeah.
question. Is baby colic caused by constipation?
Yeah, I think a very good question from Miss Wong.
SK.
So,
Ah.
uh, SK. So, baby colic actually is a condition not caused by constipation, because a lot of time people thought actually is related to constipation, but it's not. Easy answer, because if this child were to have constipation, then we wouldn't label a child as a baby colic. So, baby colic is actually a very specific condition where a child actually has uh, tummy ache that actually lasted from the time when they are 6 weeks old up to when they are 5 months old. And this period is a time when actually their bowel development and also the neuronal development is actually happening. So they will actually experience excessive bowel movement that actually they causes what perceived to be pain. So that's why baby actually causes what we call colic in babies. As opposed to constipation is actually when a baby actually pass hard poo. So baby who has actually just colic, they wouldn't have a hard poo. So this is the two main difference. So for baby colic, there are certain other treatment that we can give. That's when probiotics actually can help in baby with colic, as opposed to constipation that we don't prescribe probiotics a lot. Most of the time, we will actually give them stool softener. Yeah.
Okay, thank you so much, Doctor. And thank you for those who have asked us questions. I hope that everything has been answered. And well, it looks like we've covered all of our questions. Dr. Ong, before we go, is there anything else that you wanted to cover before we wrap up?
Yeah, I think it's actually a common problem that actually need to be addressed, because children with constipation often when they come, they would already develop very disturbing symptoms like tummy pain, to the point that actually they are absent from school. They are actually not performing because of the tummy pain or the constipation. And worst case scenario, not to say worst case, but when they come with fecal incontinence, you have to imagine that actually that takes them months to develop fecal incontinence because of constipation, which means you will need the same period to undo what actually has happened. So people always, when they see me, they expect a quick solution to fecal incontinence because of constipation, but they don't realize actually this problem actually has been there for a long time. So it actually would take us perhaps an equal duration of time to undo what has happened in order to overcome the fecal incontinence. I'm sure fecal incontinence is actually very disturbing for the child because they feel insecure, which suddenly they will become very smelly in the school. So I think we need to help children with constipation in order to overcome their constipation. Yeah.
Okay, that's sad that they will get teased in
All
school. So
right,
it's
great.
very good that we have that kind of awareness. Actually, doctor, just before you
Yeah,
go, you did mention the amount
yeah,
of water that needs to be consumed, right? Different ages.
yeah,
Actually, I do have that problem with the younger ones in my family. They don't want to
yeah,
drink water, so
yeah,
therefore they have this problem, and it's actually really difficult
yeah,
to make some kids drink water. They just want
yeah,
carbonated drinks every day, all the time. So yeah, it's
yeah,
a bit of a challenge.
yeah.
Yeah.
Yeah, yeah. So I think it's probably a habits lah. Yeah, that actually is
Yes.
need to build. I mean, whatever that actually is being introduced to the child earlier on. So you probably need to undo it and try to inculcate this kind of habit. Once you know that this is going to help them. Yeah,
Yes, thank you, Doctor. Thank you so much. Okay,
yeah.
so it looks like we've covered everything. Thank you for your time once again, and I apologize for the wait earlier. And well, thank you, everyone. We appreciate you being here. Thanks again for joining us, and Happy New Year and Merry Christmas to you, whoever is celebrating Christmas. Merry Christmas and Happy New Year. So we will see you our next webinar next year. Thank you, Doctor.
All right. Hi, hi. Merry Christmas and Happy New Year, everyone. All right, bye.
Bye.